My name is Dr. Kevin Patrick McCarthy. I'm a minimally invasive spine surgeon at the Spine Center in Baton Rouge, and today I'm talking about endoscopic lumbar fusion. Lumbar decompression and fusion surgery is a common surgery done today for patients that have lumbar stenosis or narrowing of their spine. This can result in a pinched nerve in their back and can cause pain in their back and legs. We decompress the spine or remove the structures that are pinching the nerve, and through that process we create an instability, and that's why we have to fuse the spine or stabilize the spine. We do that by placing screws and bone graft to stabilize it and hold it in position and allow it to heal in that position. This surgery is traditionally done through large open incisions, and that can result in significant blood loss, long hospital stays, and significant postoperative pain and disability. The trend has been to move toward more minimally invasive spine surgery. This is surgery that's done with the same goals as open surgery but through smaller incisions, and as a result, the soft tissue envelope surrounding the spine is not as disrupted, and patients can experience less postoperative pain, less blood loss, and shorter hospital stays. Minimally invasive spine surgery is traditionally done through 2 to 3 centimeter incisions in the low back, and this technique has been further developed recently to an even more minimally invasive technique using endoscopic surgery. I've been using endoscopic spinal techniques for the last 10 to 12 years. Initially, we did simple discectomy procedures where we removed the disc material in a herniated disc. We further progressively developed this technique to the point where now we're able to do lumbar fusions through the same tiny poke incisions. This technique has been aided by the development of new technology, including expandable cages. These are small devices that are inserted through a small incision into the inner body space, and we can then expand them in that space, taking up greater area, allowing greater fusion. Bone graft can then be inserted through a cannula into that space surrounding that new expandable spacer. Once the inner body device is in place and expanded, screws are then placed minimally invasive through small poke incisions in the skin, and this allows the fusion to be stable and complete. The advantages of endoscopic spinal fusion are much smaller incisions, less tissue disruption. As a result, the patient has much less pain, there's much less blood loss. This can often be done outpatient, where the patient goes home the same day, hours later. If you'd like to know more about endoscopic spinal fusion, visit our website or call our office for an appointment.